Off by introducing, we haven't had a Q&A for a while, so we're talking to the Oyate out there. We've been having Q&As, question and answering sessions for the pandemic and COVID-19, and any questions that they have out there, we have the people here to answer those questions today. So we felt that with the numbers going up and the vaccination being people getting vaccinated, and we needed to give an update to the people. So we'll go down the line from down on the end down there, and we'll just introduce ourselves to our people that we will be answering the questions today. So we'll start way down the end. Stella, right down there.
Oh, I'm Catherine Blackler. I'm a lead contact tracers with the contact tracers.
Good afternoon, everyone. My name is Skyla Fasthorse, and I'm the health director and the POC for the task force.
Good afternoon. I'm Melody Price-Yance. I'm the Chief Executive Officer at Indian Health Service.
Hello, my name is Dr. Natalie Holt. I'm the Acting Chief Medical Officer for the Great Plains Area Indian Health Service.
Good afternoon. I'm Dr. Montelo, Kimberly Montelo. I'm the Acting Clinical Director at the Rosebud Service Health Unit.
I'm Scott Herman, President, Rosebud Sioux Tribe. We have over here, we have some other guests that will be answering questions.
Hi, I'm Sammy Wan. I'm the Assistant Director of Nursing at the IHS Hospital.
Good afternoon. My name is Callie Raymond. I'm the Chief Nursing Officer at the hospital.
That's it, Daniel. Okay, today we're going to take questions from the public, and we're going to try to answer them the best we can. We want to open up with the Health Administrator. She requested a Q&A, and along with Melody Price, the CEO of IHS, they requested that we give an update on our vaccinations and our numbers and what we are doing to prevent COVID-19. So we'll start with Skyla. You want to open up with
Okay. So good afternoon again, everyone. So the purpose of our Q&A is to try to get as much information and clarity out there to the public. I know there's a lot of confusion and a lot of misinformation that some people are going by. So the purpose of this Q&A is that we have all the key people. We have doctors from IHS and also from area office, and then so we can answer questions or concerns that the public, like the general public, may have. And I know that with the CDC guidelines, with changes that we try to adhere to that as well. So we can start with the first question.
numbers are posted on local pages, why is the variance of concern, which is the box there in the charts that you guys post? It says, why is the variance of concern section not broken down into which variance of concern? Meaning, how come those numbers don't change? They just stay the same.
Good afternoon. The variants for Todd County are reported through the Department of Health at the state. So when we have a positive COVID test, we're able to take a PCR test. That PCR test or swab is sent to the Department of Health, and they run that, and they do what they call sequencing to tell us what variants are there. The state does not report back to the county on the specific variants. They'll just list them for the whole area.
Okay, we have a question for Scott. If the cases were higher than the numbers we have today, what would the numbers need to look like for you to be comfortable enough to issue a stay-at-home order or a lockdown?
Well, the numbers have been rising, but they have been coming down as well. And right now, the only thing I would probably recommend, if the numbers went too high to a point where we had to shelter in place, that's what I'd probably call for a reservation-wide shelter in place, which means that only essential people would be out and about during those hours of work. But yeah, that's what I would do. I would not call for a lockdown. It would be just a shelter in place. So that would be social distancing, wearing masks, mandate, businesses having only a certain amount of people in there at a time, and so on, like we have had shelters in place before. So
yeah, I was just going to ask, is it going to be something similar like it was in 2020 when it first started, besides the lockdown part?
right. And, we do a shelter in place, but we do have a problem with people actually being essential and working, and the ones that are staying at home and actually not following the shelter in place, and they tend to still go out and about and try to do their businesses, and still kind of defeats the purpose of a shelter in place. So
A question for maybe anybody can answer this at this point. Can you just kind of run through again what a close contact be? Because it kind of seems like people get confused whenever they're in close contact with somebody who's with COVID. They automatically want to go get tested right away.
Certainly. And actually, we've got an information sheet that we are going to be handing out with our home testing kits. So a close contact is considered within 6 feet for a total of 15 minutes or more to someone with COVID 2 to 5 days ago, especially if you're not vaccinated.
Okay, so for example, if we were close, like within close to 6 feet for 15 minutes, that would be considered and exposed, right?
That's correct.
Why is there such a huge disparity in the numbers between school, the tribe, and the state?
That's a question that we were talking about today between another employee, and we were looking at the numbers for the state and how they were so high compared to the tribe's numbers. And I believe it's we only count the numbers that are, when they're tested here, we only count those numbers. We don't count people from other people that use other clinics and have reported those numbers. So they report those to the state, so that's possibly why the numbers are so high, are more higher than the state's numbers are more higher than the tribe numbers.
Why does our lab work always have to be sent off? I just got out of the hospital and it was up here they were trying to send off the blood work. They shipped me to Sioux Falls, and within 2 hours after I got there, they started treating me because they took here and everything and started running treatments. How come we can't do that at IHS?
Well, the Rosebud,
Antibiotics and everything else.
Yeah.
It was quite a recovery.
Shu, we're online too, so there's probably questions ahead of you, so you
Okay,
have a
so I
question,
just
can
wanted to ask.
you raise your hand, please?
Yeah, I did,
Thank you.
and I just wanted to finish my questions.
Yeah, go ahead.
And that's what was one of them, was why is our lab so far behind on stuff, and why can't we get that updated? Another thing is the pharmacy supplies. If you're a diabetic too, they can't even get test strips, I don't know what's up with that. Everybody's helping each other out in the photo. I mean, there's a lot of things need to be corrected. While I was in the hospital, I went to the task force, stopped by and see my family for 2 weeks I was gone. That was another deal that was kind of, everybody was, they needed to be taken care of too. I mean, you can't just get some people everything they need and then leave others out. You got to look at the whole thing, the whole big picture. Keep it going, and you just need a lot of help up there. That was the scariest thing I ever done in my life. And it's no joke. I'm telling you right now, it's no joke. We need to get more help up there if we need it. And I know it's hard on you guys. I know there's a lot of, we need doctors up there. Doctors that can help treat this COVID. Start treating the antibiotics, start getting them in you. I was vein fed for a couple of days there. It's not fun. There's nothing fun about it. So I just wanted to know if you guys can start improving that, treating it better, getting the antibodies going. Right now I still have family members that are sick, and it's not pretty to watch them either. It's no joke, COVID, I'm telling you right now. We got to get better at it in order to help our people. Thanks, guys. Do a good job.
Yeah, I mean, absolutely. This is very serious, and that's why we've been really pushing from the get-go the importance of vaccination, which is by far the best defense against getting seriously sick with COVID. In terms of treatments, I think that the IHS has tried to be consistent with what the private sector is getting. I think IHS has been aggressive really from the get-go when it came to testing supplies and vaccinations and now therapeutics. We have access to the monoclonal antibody sotrovimab, which we do administer at the IHS. Like all hospitals, those drugs are in short supply. So we do have to prioritize patients to the ones that, based on research, are going to get the sickest the fastest. None of us want to do that, but that's the reality of it, because we don't have a supply to just be able to treat anyone. That is something that, I think that we're all working on, trying to be as advocating for the community as much as possible to get as many resources drugs-wise to our community. Recognize that a lot of our community has risk factors that make them more likely to get severely ill. So we don't want to be the limiting factor on treatments. But it does take a lot out of the staff to be doing the testing, doing the vaccination, doing the treatments, as well as dealing with all the other health problems. We're dealing with a major influenza cases at this point. So, as all of this is happening, we do have to take care of all the other things. But I'd like to think that we're trying to be as aggressive as possible as being able to offer the treatments as they become available to the community.
Question for the Skyla. Or has the Omicron variant, or maybe anybody can answer this, has the Omicron variant been detected in the RST area?
County can, yes, so when we send in our confirmatory swabs or the PCR swabs to be sequenced to tell us what variants they are, they'll send that information back just for the whole county. They don't specifically send each facility what that tested positive for, which variant. But if you're able to monitor that on the Department of Health, the South Dakota Department of Health website,
They have a dashboard on there that shows trends for each county. And if you go to that, Todd County, it states has 20 variants of concern, but they don't break that down farther. They just tell us that there's 20 variants within Todd County.
I see that the prevailing wisdom would be that 99% of what we're seeing right now is Omicron throughout the country. So like Callie said, it's impossible to test every single sample, so they're just doing a little grouping of them. But if you project that to what it probably is looking like, it's probably looking like a vast majority of them are Omicron.
Daniel, Marty, answer the question when you okay. When it's her turn.
All right. We'll speak to the public really quick here. Again, if you have any questions, the phone number to call is 605-747-2428. Again, that's 605-747-2428. Okay, so here's another question. Is the home COVID test kit reliable? If so, is it acceptable to use to either return to work or after quarantine?
Well, we've had very good results with the home test, so the answer is yes. Particularly with the relatively high prevalence that we have in the communities, those antigen tests, if it comes back positive, you should trust that result. If it comes back negative, you should trust that result. In terms of policies related to return to work and whatnot, that's going to vary by the employer, what they want. Our general recommendation is that if you get a home test, there's no need to validate that with a test that you would get at a clinic or at the hospital. But work policies, that probably is going to vary on the employer to employer.
Question for Scott. Does the tribe still have a travel restriction in place for tribal employee business trips?
No, not at this time. No, they're allowed to travel. They did have a restriction during our shelter in place. We had a shelter in place for our tribal programs, our tribal employees. Only at one time, only the essential people were working for the programs. At that time, we had a travel ban, but it's now lifted, so they're allowed to travel.
Question for Skyla. Will there be more weekend vaccinations and booster clinics for people who can't make it during the week?
So to answer that question, I think we're going to continue to do the vaccine, or the Binax drive-throughs on weekends. We tentatively have a plan, but that won't be set in motion until we work out the logistics of it. But right now, there's the drive-throughs for IHS through from 9 to 4, Monday through Friday, and or 9 to 6, sorry. And so, but with that being, the vaccinations is done through IHS, so that will happen as well, and you can contact IHS on that part of it.
So if somebody is indicated tested positive, you said after that point a PCR test would be administered. Myself personally, I was told, I went in Monday, did a drive-through, told negative. Next day I get something from the state of South Dakota that said you tested positive. And so I called the state of South Dakota, then I called IHS, both told me, yes, you were tested positive. That same day, went through drive-through, came back negative. I've taken one every day from the office as coming back negative, but the State Department still considers me a positive test, and nobody has reached out to me in any way, shape, or form to get that next level of testing done. Who's supposed to do that, and when would that occur?
Sure. So when anybody tests for COVID, using, like, say we use the Binax tests or the Abbott's within the hospital to test for COVID, we do a sample. So it was established with the Department of Health. So like for our hospital, we need to do at least 15 PCRs a week. So Through the ER, like when somebody comes in and they test positive, we can obtain a second swab for that PCR test that is sent into the state. So we've had communication with our contacts at the Department of Health, and based on formulas and such, at least 15 a week is what they said would be adequate. So not every person that tests positive for COVID has to have a PCR, but yeah, yep. But the treatment, everything's the same. So no matter which variant a person has or thinks they have, the treatment's the same.
I have a question from Carol over here.
This is for the task force. I have a granddaughter that plays basketball for Todd County, and she's been on isolation. She tested negative. They said she's on isolation. They came out and delivered the supplies and the food cards. And so we asked then, since she was negative, if she could test again within the 5 days, and if she was negative, if she could get off isolation. And she was told yes. So we went in and she got her test and she was negative, and she went to go back to school today, and they told her she can't return. And then the task force called and said, yeah, she can't return. So how does that work? That only a few of the ball players were on isolation and all the rest were in school and going about their business. She is breaking down. You don't know how hard this is on a teenager. And I don't know what to do, what to tell her. So what do I tell her?
Okay, I'm Catherine with the Lead Tracers. So I'm not sure, and I do apologize for it, I'm not sure who told you that you could get a test and she could go back, because that's not our policy. They have to do the whole 10 days, either if they get a negative test or not. So I apologize to whoever gave you that information. We'll find out who said that and we will fix it, but she would have to do the whole 10 days. And it's, the only reason that there were some contacts were, it was the basketball team, it wasn't the whole basketball team, it was just some of them, so that we only contact the ones that had to be quarantined. It's the close contact, the 6 feet and the 15 minutes. It's just those individuals.
And she was not then listed as?
Yes, she was listed as one. But I do apologize for the misinformation. I don't know who would have said that, but we'll find out who did and we'll fix it, okay?
All right.
Question for Scott. To help keep positive COVID numbers down in the programs, could all the program offices have mandatory sanitations over the weekend to keep programs clean and COVID free?
Possibility to do that. I don't know if we can get all the programs during the weekend, but we can sure try, Daniel. So that is a good idea to do that. So they'd be ready for that Monday morning when they come back. So we're also talking about doing some type of rotating schedules for programs, having so many of their employees, maybe a 50% of their employees working, 50% of them staying home for a certain amount of days, and kind of like the hybrid that they're doing at the schools. So that's been an idea we've been talking about doing too with the programs.
Is that going to come up at council at all at some point?
It probably will at our next task force meeting, and the task force, what they do is they make recommendations to the tribal president on what they think that we should be doing. So that's where the direction the tribal president gets his direction from. So.
Another question we have here is, why have COVID restrictions changed so much, and will they be changing again in the future? I'm pretty sure that could go for both.
I could probably answer that. We had a task force meeting probably about, I think it was like 3 weeks ago, and we had quite a number of people at our task force meeting, and we talked about, is this 5-day CDC guidelines, isolation and quarantine, is it really working? And we're finding out that maybe that wasn't long enough. So the task force wanted to try to do a 10-day isolation quarantine, and not basically follow the CDC guidelines. And so we tried that, but we're getting so much negative feedback on it, it's not working. People just don't want to quarantine that long a time. They're talking a little bit about what's the point of getting vaccinated if you can't come off quarantine, sooner than 10 days. And of course, the sports, like Carol said just a little while ago about the whole basketball team being put on quarantine for 10 days, that's a mandatory thing that we set. So is that really working? Probably not. So they had another task force meeting the other day, and they recommended that we do go back to following the CDC guidelines as far as isolating for 5 days and quarantine for 5 days. So I'm going to come out with a memo basically to the public and stating that we're going to follow the CDC guidelines as far as the 5-day isolation and quarantine. So that's going to be changed back. I think I answered the question. No.
And then, do you know, maybe Scott, you could probably answer this too. Is there any penalty in place for those that refuse to isolate and quarantine?
There are many cases out there where there are people getting sent to jail because of their failure to quarantine, and they are putting the bonds pretty high as far as that. So, but there are plenty of people that are testing positive and they're refusing to stay home. They're refusing to quarantine, and as we get those names, we report them to the police, law enforcement, and they do go out and check on them. So it's not like we're not trying to enforce it, but it's very hard when people are doing that out in the public. It all ends up to being personal responsibility. If you're sick, stay home. That's the only way we're going to stop the spread. So.
Question for IHS. So why do you think our vaccination numbers are so low for tribal members, and what is preventing people from getting the vaccine?
I would imagine that the vaccine numbers are low for tribal members for the same reasons that they're low in the general population. There are some people who maybe are reluctant with the newness of the vaccination to go ahead with it for fear of side effects or unknown health effects. And there are others who, by principle, don't want to be told that they need to be vaccinated. And I guess coming at it from the clinical side, I don't think any of us want to tell people what we want to do, but we want to educate them that vaccinations have such a good track record of keeping people out of the hospital and avoiding unnecessary deaths when it comes to COVID. But I really think that the concerns among this community and members of this community are the exact same ones that are happening throughout the world.
Question for Skyla. Do you have weekend workers that keep track of those that are in isolation and quarantine? I think I already asked that, right?
Yeah, well, kind of a little bit different, but yes, we do. And then the tracers are on a shift schedule. So someone's covered 7 days a week, to be working. And then the tracer, we try to put the numbers out there for the landline, but the landline for the tracer building is 856-2016. And sometimes, the tracers do try to call people back when they're trying to put them, get in contact with them, but for some people don't answer them. They don't answer their phone calls, and so we kind of have a problem with that too. So it's kind of vice versa. They try to call people and then they don't answer, so.
And are you guys going to be doing any testing in the communities at all? Again?
That's kind of a plan that we need to revisit. We were having the tracers, they were doing it in the communities, but we refrained from doing that just because of the fact that, there's a drive-through Monday through Friday at the DPP parking lot. So we were trying to, restructure that portion of it. So let the general public go through, and then the tracers, because in actual reality, their duty is data collection. So we refrain from doing that in the communities.
Okay. Sorry, I had the question here. Are there any other new variants being looked at on global level? And what is in store for the future?
There's one subvariant of Omicron that is being looked at and has become prominent in like over 50 countries throughout the world. Based on what we know now, the way the virus acts is pretty much the same as Omicron. So it doesn't appear like it's going to cause any significant changes, and we're not hoping at this point that it will cause another surge. But that is the one that has the most radar on it now in terms of variants.
My name is Keith. I wanted to ask the IHS, when you say in 6 feet to 15 feet within 15 minutes, is it indoors or outdoors? Because mostly we talk about is indoors. When we're outdoors, when somebody is positive, well, they'll catch it.
Generally speaking, that 6 feet, 15 minutes would apply to the indoor setting. Outdoor, there's so much variation in the airflow that I think it's really hard to come up with anything hard and fast. I also want to say with the 6 feet, 15 minutes, that was started in the setting of no masks. You know, now we're all wearing masks. So that probably changes the dynamics. But to be honest, we're at the edge of our scientific knowledge here. So it's the best estimate is that 6 feet, 15 minutes, but I'd say applied to the indoor setting primarily.
And kind of a question related to that one. Can you explain the different, or like the masks that people should wear and not wear? 'Cause I know there was something around the news that saying they have to wear some kind of a certain mask that they shouldn't wear.
So what we're converting to or changing to is like the KN95s. Remember, they look like the duck or coffee filter looking one. But I found our vendor found one, and it has a second layer across the front part of it, so it's like a double layer. So that's kind of the new mask that we're going to, and we're gonna try to move away from the surgical mask. And not only that, it's just because of that double layer that will help do that double protection. So those are the new ones that are coming to my office. And hopefully we can share enough of those with the public. But the surgical mask, do its justice as well too, but just for that extra protection, we're ordering that double flap across the top layer.
Why is the 14 period 10 to 14 days for close contact negative tested persons? Why not just 5?
As Mr. President mentioned earlier, that on January 7th, we had a task force meeting, and at that time, the numbers were pretty high, and it was a concern for a lot of people, and there was a lot of people at that meeting. And then, we were having a lot of issues when we were delivering the food cards and the food supplies, because we were getting calls that I didn't get my card, or nobody came and gave us supplies. But a lot of those people, and I'm not saying it was them, but there's a lot of people that were home, and CHR was going out to these people's places, but then when nobody was home, so then they moved on. And so we ended up deciding to go with the current CDC guidelines and revert back to the 5 days of isolation and quarantine, because it's making it tough for people, especially with the weather being going to be coming nice. We're here in February now, the month of February. So spring's going to be upon us, and it's going to make it tough for people to want to comply. So we just want to go and go with the CDC guidelines, the current guidelines.
So is there any truth, validity, science behind the people being vaccinated, booster, that it's taking them longer to come up positive in a test? Or is that just rumor, hearsay? Because that's kind of why the tribe, you had extended it to that 7 or 10 days or anything, but is there anything real to that?
I don't think that there is any strong scientific evidence that people who were vaccinated or boosted are actually taking a longer time to come up positive. The coming up positive on the test relates to, you know, how much the virus is reproducing, right? And so that's going to vary by person. But I can't say that I've seen anything that hard and fast says that that's probably happening more often in vaccinated booster people than non.
My other question, initially when this all started out and they did the nasal swabs, gee whiz, they were jabbing it way up there, and now it seems like it's less. Is that kind of a change in recommended protocol? Is it that we're getting a number of different operators, you know, involved in it, and one person does it one way and one person does it another way, or is there anything to that?
I think there is. You know, in the beginning, the only tests we had were the ones that were the nasopharyngeal, where we had to really make people gag in order to get it up. And now we do have tests that are more mid-nares, so it's not wrong that they're not choking you when they're doing the test. That being said, you know, there's gonna be, whoever's doing the test is gonna have some variability. And that, I think, is one of the reasons why sometimes you hear people who, you know, test positive one day and then they test negative the next day, and there's confusion. There's operator issues with any test, you know. So I think a little bit of both is the answer. The strategy, the testing of the mid-nares is now more what we are doing. But there is operator differences that probably account for some of the variability in the sample they end up getting.
Yeah, it just seemed like kind of standard from the beginning, that now they're, you know, it's like going into the opening and but it's actually a difference in the type of test from then until
Correct.
now.
Yes.
Okay, thanks.
A question, maybe Skyly could probably answer this one. Is there a reservation-wide curfew in place?
Yes, there is.
There is?
We have it in place, but we're not fully enforcing it. So, I know President President Scott had that in place, and it's at what, did he increase it from 10 to 12?
Yep, at midnight.
So it's at midnight, but.
So it's midnight to 6 a.m.?
Mhm.
Okay. I think people are kind of confused about qualifications with the booster shot. Can you just go over simple steps of who qualifies for a booster?
Okay, yeah. So anyone 5 years and older is eligible for a booster shot. 12 years and older. 5 years is anyone is the vaccine eligibility. 12 years and older is booster. If you got the Moderna or the Pfizer, the recommendation is to wait 5 months in between the first and the second shot, and 5 months to the booster.
And 6 months for Moderna, 2 months for J&J.
Right. Sorry about that. That's why I have these.
Okay. All right. Let's see what else we have for questions.
I have a question. I don't know, maybe Kelly or you can answer, but so we get a lot of concerns regarding false positives, and I don't know what the probability is of that is for that occurring. And then I know when we were doing the drive-through, I have gotten some concerns saying that temperature may be the cause of it. So I don't know what the false positives come in, or is that just, are the tests pretty accurate?
The accuracy of the Vinex test that we're using is pretty accurate. And we're actually just reviewing that again the other day, so it's like 76 to 80%
Accurate.
specific. We did have concern on when we were doing the drive-through testing, so we discussed it, looked at all the factors. We did question if the temperature would have any effect on the swab. And then looking at the manufacturer's instructions for use and discussing it with our area lab consultant, as long as we keep where we run the tests on the cards between a certain range of temperature, we would be fine. So even going out to the car and collecting the swab and going back in right away, we were told it would be
That
fine.
shouldn't affect it.
And we
Okay.
have heat in DPP, so, they've been great. They have a heater on in there, and then, the hospital has a large heater over there, so we can get, warm in there, but the temperature is correct for the test.
Also, and I don't know, Skyla, you could probably give a little bit more better timeline on this, but how soon will they be issuing out at-home tests? I know I went on what was it, COVID.gov and
Yeah.
ordered our own four personal ones for our households, but
Yep.
I didn't know if health admin's given some out.
Yeah, we're, so what we did was we got, 5,000, at-home tests. They're the Flonex test.
And so we have yet to, we're kind of collaborating with IHS, what they're doing with their at-home test, and then ours, and then we want to share the flyer that they have. It kind of matches or mirrors what we're trying to put out there to the public, how to do that. So we're hoping that within a week here, we'll be giving out those home tests out to the general public.
And I think at Indian Health Service, we're ready to either put them out, I don't know if we did today, but if not today, then potentially tomorrow, we'll have them in various areas, just throughout the hospital.
So I just had a personal concern on it because I know when I went to COVID.gov, I had to put in my physical address. And I know a lot of our tribal members utilize a post office box.
Yeah.
That was how they were being distributed, but then are you gonna put out a timeline for that?
Yeah, so we'll put a plan together to get that out there to the general public, and then how to report their positives. That's another thing that we gotta regulate, because we have the food card and we have the cleaning supplies, so we don't want everybody saying, well, I'm positive, and then we don't have no way of verifying that.
There was people who were getting tested for COVID came out negative, but they were still having symptoms the same as COVID. So meanwhile, after I think it's like 5 days, after you're supposed to go get tested again, they still came back negative, but still similar symptoms to COVID. Is there anything?
Okay, Callie. So if somebody tests negative but they're having the symptoms, they should just continue to treat themselves. They should isolate, monitor the symptoms. So the viral load in somebody's body might not be high enough for the test to pick up. So they could still be contagious, but the test is coming back negative. So yes, they should monitor themselves at least for the 5 days, and then go from there.
What are some of the, I hear concern, so if I tested positive, will the antibodies stay in my system for a period of time where I won't test negative for a period of time? Or do I have a potential for testing positive again, like twice within a month period? And I'm just saying because I get exposed a lot, so I don't know.
Yeah, so, current, CDC, literature states that, if you're COVID positive, once you come off of isolation or quarantine, you shouldn't need to, retest. You have a potential of testing positive again up to 3 months or 90 days after you are positive. So you're right, antibodies, it's just still in your system. So you have that potential, you can test negative, but you can also test positive again.
Okay. Thank you. I'm having people text questions into me, so. So a lot of the flyouts from IHS, are they COVID related? I know we've had a lot of patients that were sent out of state, and one of our council reps just asked if they were COVID related, are they non-vaccinated? Because we're trying to really get our vaccination rates up, but we don't know how to.
Yeah, we have had, the last few days haven't been, as hectic as it has been with the volume of patients and acuity, but currently we have one COVID positive patient on our inpatient floor. And as far as transferring patients out for COVID, we've been able to
keep our positives, if they need that higher level of care, we've been able to keep them at the hospital, and we have everything to support to that level that we can. We have not had a lot of transfers out specifically for COVID.
I think externally right now, we've got 4 COVID patients in outside hospitals. They've been there for a while.
Have you seen a rise in children getting COVID? Like young?
You know, that's been reported nationally, but I don't
Yeah.
really feel like we've seen that regionally here.
Okay, we'd just like to let the public know that we have 10 minutes. It's 3:15 now, so we have 10 minutes left. Real quick question here. Is it safe to go back after 5 days if you have tested positive for COVID if you're still not feeling well? I'm pretty sure that's referring to wearing a mask after the 5 days are up.
Your employer. So if you're test positive, and are you essential or non-essential? So like at the hospital, say nurses being essential, I could test positive, I'm at home, isolate for my 5 days, I'm without fever for 24 hours, I still have a slight cough, maybe a dull headache. It's up to your employer if you return to work, but being essential, we would have to wear an N95 mask, which is a higher level of mask than like the cloth or the surgical ones we wear all the time. We would have to wear that N95 at all times in the facility for additional 5 days. But if you're still having fever after those 5 days, you should stay home and continue to monitor yourself.
Okay, this might probably be for Skyla. When a person is positive for COVID and is out in the public, what are the current repercussions for someone who knowingly has COVID-19 but yet is out endangering the public?
So the tracers have a formality in how they deal with that kind of situation. So Catherine can elaborate because they work closely with that type of situation.
Usually we only get reports of either someone calls into our office, tells us that someone has been, out of isolation that is positive. Then we ask those people that called in to report it to the PD, and then we'll report it as well. So we'll report it to the PD, tell them if they're out, and then I will send a team out to go see what's the issue, because sometimes we have people that were at medical appointments, or we're sleeping, or however, but we still send a team out to verify it. And if that person is not home, we will report it to the PD. And then, unfortunately, I don't know the process after that, so.
And also, there's somebody that said if they lost their vaccine card, they can actually go into IHS, right, to the and check in and get a new one.
They report to medical records.
Medical records. They report to medical. Okay. I think we might have one more question here. Okay. Why are the numbers between the state and task force so different, and which number is actually true?
So our numbers are what we report every day. We put them in. Unfortunately, with state, there has been some, downsizing in their departments, and so there's a lot of things that have been getting missed. We have seen it. We're trying to fix it with state as well, but it's just taking time, and they're as busy as we are, so we're just kind of, our numbers will be different, but hopefully it'll be worked out soon.
I think another issue with that isn't like Horizon Health Care isn't mandated to report to the tribe either. So if we have tribal members testing positive at Horizon, they're not going to give RST their numbers. And even like where I live in Gregory, our tribal members get tested down at Avera. So, they're not, the only way it gets reported to the tribe is when they call it in for the services, so.
Like all we get reports are IHS. Very seldom, maybe once or two people will send results to either my phone or they'll call and say, I'm positive. So then I'll forward it on to the tracers or whatever, and that there is so they can get the services as well, because we've kind of put it out there at the general public that if you want the services for the food card and the supplies, if you test outside the IHS facility, you need to show us some kind of documentation that you're positive. So we do get some of those, but like Lisa said earlier, that those outside facilities will not work with the with my office or the task force and tracers, and because it's against HIPAA for Cherry County to call and say, oh, this person's positive. It doesn't work that way because there's that HIPAA law that everybody. Yeah. So there's that possibility that may be one reason why the numbers don't jive with what we have.
And when you brought up the state, those that are done with isolation and quarantine, do they need to get a letter from you or from the state, or both?
So what we do in that sense, the state they may provide a letter, but what we do here, since we're located centrally here for a lot of the tribal employees, so what we try to do is we work with the tracers, since they're the ones that put them on isolation and quarantine. We get the dates. We provide a letter, whether they're isolated or quarantined for such and such dates, and then we get those letters out. Because sometimes the states, they're backlogged, and it may take a week when they're already done. So we try to help the general public or the tribal employees and give them that letter so they can get paid. And then that was the issue earlier on with another director. So we're trying to tighten up something, to try to help the employees out.
It's a work letter though,
Yep.
it's not a release letter.
Yeah, it's not a release letter. Yeah.
Okay. Alrighty. I think that's going to do it for our questions. So I'd like to give thanks to you guys to taking time out of your busy schedules and coming and talking to the audience and answering questions for them.
Okay, thank you.
Thank you, guys.
Thank you.
But thank you ladies for coming and making the time.